Madison Dusek. Hi, my name is Madison. I'm going to be doing your cardiac and peripheral vascular exam today. First, I'm just going to inspect your jugular venous pressure. So I'm going to have you slightly look away. Okay, and look towards me. All right, good. I didn't see any abnormal pulsations. Next, I'm just going to note your PMI here. Very good. I don't see any abnormal pulsations there. All right. Next, I am going to palpate your carotid pulse. Very good. That's 2 plus. Next, I'm going to palpate the angle of Lewis, which is where the manubrium connects to the body of the sternum. All right, next I'm going to palpate the aortic area, which is going to be the right side, the second intercostal space. All right, and then I'm going to palpate the pulmonic area, which is on the left side, should be second intercostal space. All right, and then I'm going to palpate the tricuspid area, which is going to be on the left side of the sternal border, fourth intercostal space. All right, next I'm going to palpate the mitral area, which is going to be to the left of the sternal border, fifth intercostal space, midclavicular line. And this is also where I'm going to palpate the PMI. Which is the fifth intercostal space, midclavicular line. All right, good. I didn't note any abnormal pulsations there. Next, I am going to auscultate your carotid. I'm just going to have you hold your breath. Okay. Hold your breath. All right, and then I'm going to do the same thing with my bell. Hold your breath. And hold your breath. All right, good. I didn't note any bruits there. Next, I'm just going to auscultate all of the areas that I just palpated in the previous exam. I'm going to do the same thing with my bell. All right, good. You have a nice normal rhythm. You're not bradycardic, tachycardic, and I didn't note any murmurs or any extra sounds like S3, S4, any rubs or clicks. Next, I am just going to have you lay on your left side for me, and I'm going to auscultate all those same areas. How do you scoot back? I'm going to do the same thing with the bell. Very good, and I'm going to have you sit up and slightly lean forward for me. And when I do this, I'm going to have you slowly exhale through your mouth as I auscultate. Same thing. All right, good. Like I said, didn't hear any abnormal sounds there. All right, next I'm just gonna take a look at your upper body here and just note the color. Everything looks very pink and symmetric. I don't note any swelling or edema. I don't see any abnormal venous prominences. And your nail beds are nice and pink. No clubbing, no cyanosis. Next, I am going to have you lay back down. I'm going to assess the lower half. Great, everything looks nice and symmetric. Your legs and toes are nice and pink. I don't see any swelling or edema. I don't know any rashes, scarring, or lesions. The hair seems to be equally distributed throughout both legs there. All right, and I'm going to test, just assess for varicosity. So I'm going to have you stand up so I can look at your legs. All right, and I don't know any varicose veins. You can go ahead and lay back down. All right, next I'm going to palpate your pulses. I'm going to palpate your radial pulses and your brachial pulses. And those are 2+. I'm going to assess your cap refill. 2 seconds, 2 seconds, 2 seconds, 2 seconds. All right, and next I'm just going to assess your upper crocodile nerves here. Any tenderness with that?
No.
All right, then I'm going to assess these epitrochlear nodes. Any tenderness with that?
No.
Okay. All right, I'm just going to take a look at your lower body. I'm going to assess your dorsalis pedis pulse, your posterior tib, your popliteal. And I'm going to assess your femoral arteries there. All right, good. And then any tenderness here?
No.
In your little node area. Okay. All right, good. I'm also just going to assess your cap refill on your toes. 2 seconds. 2 seconds. Your feet are nice and pink. I don't know any abnormal coloring there. I'm also just going to palpate for temperature, and your legs are nice and warm. All right, I'm going to have you sit back up again for me. And we're going to do the Allen test. So I'm going to have you make a fist. Just go back. All right, and I'm going to occlude both of your arteries here. Make a fist. All right, and open up. All right, so your hand is nice and pale. I'm going to release the ulnar artery. And I see your hand is getting nice and pink again. So go ahead and do the same thing. Make a fist. I'm going to occlude your arteries. Okay, open. Your hand's nice and pale. I'm going to release your radial artery. All right, it's getting pink again. All right, I'm going to have you make a fist. Occlude your arteries. Open up. It's nice and pale. I'm going to release your ulnar. It's getting pink. All right, make a fist. Do the same thing. Open up. All right, it's pale. And then when I release your radial artery, it gets nice and pink again. All right, I'm going to have you lay back down one more time, and we're going to test for lower extremity artery insufficiency. I'm going to hold your legs up here until they get pale. And then as soon as they get pale, I'm going to release them, and I'm going to have you sit forward and kind of dangle your legs. All right, they're nice and pale. Go ahead and dangle your legs. Very good. I see them getting nice and pink, and I see your veins refilling there. All right, that concludes our exam for today.